Well, he dug up the old bone in the backyard again. President Trump back at war with Obamacare. He's got the Justice Department pushing the courts to find the whole thing unconstitutional. And fresh off his Mueller investigation victory, some of his biggest supporters are questioning the timing. Regardless, President Trump today said it's now or never. So
we are going to be, the Republicans, the party of great health care. The Democrats they've let you down. They came up with Obamacare. It's terrible. It's a disaster for our people. We're not going to allow it to go. So we're coming up with plans. If the Supreme Court rules that Obamacare is out, we will have a plan that's far better than Obamacare.
Some Republicans are nervous about that, including House Minority Leader Kevin McCarthy. According to Axios, McCarthy called the president and told him the decision made no sense, saying the health care battle helped Democrats win the House and several state capitals last year. The other problem, details of the replacement plan so far are non-existent. So is this the president's new move a push in the wise direction just days after a major political victory? Joining me to discuss, National Press Secretary for Trump 2020 campaign, Kayleigh McEnany is back. Welcome back, Kayleigh.
Thanks, Kennedy.
I hate Obamacare. I think it sucks. I don't like any sort of federal nationalized health care system. I think it's socialistic and wrong. I think Obamacare was an abomination. But the big problem that Republicans have faced in the not-so-recent past is they don't really have a replacement for that repeal, do they?
No, we did have a plan. It was called Graham-Cassidy. Unfortunately, we were one vote shy. But look, Kennedy, I think you'd even agree with this proposition, which, by the way, Democrats agree with, which is Obamacare is broken. It's why they're all not doubling down on Obamacare. They're saying we've got to go to government takeover of health care. Obamacare has failed. 29 million people don't have health care still.
So what is the plan?
Right. Well, Graham-Cassidy was a great plan. It's one that, as I said, the White House supported, was one vote shy. You know, I leave policy decisions to the White House. We'll see what the next plan was.
Is it Graham-Cassidy version 2.0?
That's a decision for the White House. So I don't want to get ahead. I don't want to get ahead of the White House ideal on the campaign side, not the policy side of things. But I'll tell you this: the key elements of any White House plan are accessibility, affordability, flexibility. We've already seen hints here and there of what President Trump has done, opening up access to short-term plans, to association plans. They're more affordable, short-term plans, and he's brought down costs.
I know, but the Obamacare replacement failed when you had both chambers. You don't have both chambers now, so even with a more comfortable majority in the Senate, how on earth would you get the same thing passed through the House?
Right. Well, we were one vote shy, but nevertheless.
No, I know that, Kayleigh. But let's talk about today. How would you get that same thing passed in a democratically controlled House? That's very difficult.
Instead of asking me that question, you got to be asking Nancy Pelosi and her caucus, which wants to eliminate private insurance. I mean, that's the problem. It's not Republicans. It's Nancy Pelosi and the Democrats.
The problem for Republicans is they don't set the docket, and Democrats are in charge of the House of Representatives because of health care. So even if you have the greatest plan in the world, which you and I both agree has a massive free market component, how do you convince members of the Democratic caucus who are all in on Medicare for all that they should take up and champion the president's cause?
Well, what you're asking me to do is impart rational wisdom upon the irrational, and there's no way to do that with a leftist field that wants us to go the way of socialism.
Okay,
what we can
in
do
other words,
with
you're not going to get this passed, so that speaks to some of the president's supporters who are saying this is horrible timing.
Not true. Not true, because Obamacare is failing. It's in a deathward spiral. You have the exchanges, which have emptied out of options. And this president, he's going to tackle the hard decisions, and he's gone after it with every executive option available to him, opening up other plan options for the first year.
With
Kennedy,
all due respect,
premiums have gone down under this president.
I don't think health care should be mandated and executed under executive orders. I really don't.
No, but Kennedy, you got to understand the content of the executive orders. If he's opening the free market and saying Obamacare banned short-term plans, it banned association plans, I'm opening the market, even if that's with an executive order, I think we can agree that's good, which, by the way, premiums down the first year under this president, they haven't gone up. It speaks to what the free market policies actually do.
All right, well, we need to see more specifics, but right now I think the president and Republicans could do a great disservice to themselves and really, unfortunately, open up a window for Medicare for all, which would be the worst consequence of this entire fight.
Yeah, never going to happen under this president's watch. The Republican Party is becoming the party of health care, and that means arguing against government takeover of health care, which is what the 2020 contenders want to do.
All right, Kayleigh McEnany, thank you so much.